Hello and welcome to Lakeside Listens podcasts. This is a regular series from Lakeside Healthcare showcasing some of the best things about Lakeside, our patients and our staff. Hope you enjoy it. So welcome to another edition of our podcast where today we're talking to our Chief Executive, Jessica Bawden. And so today we're going to be talking about our patient survey, which we've got running at the moment. And Jessica is here to tell us a little bit about why it's so important, why your views matter, and why we'd like you to take the time to take part.
Afternoon. We run a patient survey every year. That's because we think it's incredibly important to find out what our patients think of the services that we're delivering. So this is the fourth year the survey's run. We opened it a few weeks ago and it runs for about 6 weeks. And it closes on Sunday the 24th of May, just before midnight, 11:45. So if you could get it in so we can look at it on the Monday. And then we'll be doing some number crunching as it comes through. So you can do that online and you can hand it into the practice and that'd be fantastic. Thank you.
Can you tell us why this is particularly important? What do we get out of it apart from just the general things that are the same as the National GP Survey?
So the National GP Survey is run by the government and it goes to every single GP practice. And a random selection of 100 or 200 people are chosen to take part. It's a very useful survey because you can benchmark yourself against other people, but actually the numbers are quite small, so it doesn't tell you a lot, and also there's no free text. So you get some data, it tells you how you compare, but it doesn't really tell you the detail of why somebody might be happy or unhappy with something. So our survey has very similar questions, but it gives people the opportunity to give their own view and tell us what we could do differently. And that's what's so important about our survey, is that we make changes on the back of it. And so we are really looking forward to that kind of qualitative data of the information that people give us. And one of the things we do is that we work with our patient participation groups around the questions. We tend to keep some the same every year to make sure that we can compare with the previous year, but they always input into what we are putting out there, but also what we then do with it. So we share the results of those surveys with our patient participation groups so they can see what the people they represent are feeling.
Working in the background and seeing quite a lot goes into the survey and quite how serious it's taken when we get all the results back. I would say it's probably one of the biggest things we do per year in order to gauge patient sentiment. And I know that you get together with all our lead doctors from all our practices. We look at all the data, all the comments especially, and we also look at key trends, don't we? So it's really a good way of benchmarking, isn't it? And like you say, year on year, we've made improvements and we've taken some of the information and it helps us to inform what we do.
So one of the things that we've done is we've introduced a way of looking at appointments and people's needs through total triage. So every morning and afternoon we're looking at requests that come in and working out what's the best way of dealing with them really quickly. So it might be that we can actually sort out a prescription straight away, or that they need to come in and see the doctor and that they need to see them face to face. But we're using our online platform a lot, where people can still come in and speak to the receptionist and they can still phone in. But it gives us as much information as we need to be able to make a decision quickly about what needs to happen to that person in the first instance, and they'll get a call back about what's needed. So that's changed the way we're working a lot. It's also given us a lot more appointments because we're more efficient. And across all of our practices, we've increased our access by 25% in the last year, which we're all really proud of. And it's actually been more positive for the staff as well as the patients, in that they feel that they are meeting more of the needs of patients instead of being in a position where they've got to a certain point in the day and there are no more appointments left. So we hope that we're doing better by our patients in creating better access.
And I know that some of the ways that we're seeing that is we are getting better feedback, and also like things like Google reviews and feedback postcards actually in the practices where they have them. That has shown a definite trend. People are liking Anima. People are seeing the differences in the things we've introduced since last year.
And we don't get everything right all the time, so there's always time to learn. So I'm sure from this year we'll find out some things that we thought we'd got right that we haven't got right. And so we're just doing our best all the time and listening to what people tell us.
Fantastic. And I think for those people that aren't necessarily happy with computer access and everything, there are paper copies in reception.
That's right.
And I know that the receptionist would be happy to help people fill it in if they are unsure or if they need a bit of a hand. But generally, if you want to take part in the survey, there's a link on our website. So if you go to your practice website and click on the link in the news item, that will take you to the survey. I know that practices have been texting messages out to patients as well, trying to encourage them to take part. And also, we're promoting it on Facebook as well. So just click the link, take part. I think there's about 10-15 questions, so it should take no longer than 10 minutes to do, and it's just the sort of thing you might want to do when you're sitting down with a cup of coffee, and just remember and think, oh yeah, I'll just put my opinion in. We can guarantee that your opinion does count.
It does, and we look at all of the responses actually. And we share them with each site as well, so they get to see that the management of the site, as well as the lead doctors and the partners there. So they get a feel for, they're busy at site. They're people are coming in and out all day. They don't often get time to think and reflect about what we could do differently. And whenever we can make the changes, we will make changes. So your views are really, really gratefully received.
Fantastic. Thank you very much.
Thank you.
Thank you for listening. This podcast is for entertainment purposes only, so if you do have medical issues or want to discuss anything raised in this podcast, please contact your own GP surgery. If you have a story or topic you want to share with our patients, then we'd love to hear from you. Please get in touch. Thank you.